Welcome back to Great Day Medical Monday. While vein disease is common, it doesn't mean it should be ignored. Itchy, swelling, achy legs can get worse over time. Our next guest offers a variety of treatments with no downtime or painful procedures. Vascular and interventional radiology specialist Dr. Tonie Reincke with the Reincke Vein Center has seen the treatment for vein disease come a long way. Can we get an amen? She's joined by her patient, Valerie Baldwin, who will give an amen as well. Good morning, ladies. All right, Dr. Reincke,
morning.
I remember friends of mine, their parents got what was called vein stripping, and it was such a crazy process. You remember that as well, which is one of the things that kind of, brought you into this business.
Yeah, that was probably 20 years ago, back when I was a surgical ICU nurse. We used to recover those patients. It was kind of a brutal surgery and a long recovery, about 6 weeks.
Yeah, and you want people to know if that's what they're thinking this is to address vein disease, it is not anymore. There are new procedures.
That's correct, yes. Minimally invasive procedures done in the office. They're in and out. They're back to their normal activities the same day.
All right. Valerie, what were you noticing with your legs? You worked in the medical field. You were on your legs all day, which is, oftentimes people who stand all day, teachers, the whole bit, who stand a lot may be prone to vein disease. But what were you noticing with your legs that you finally could not ignore?
Deborah, I was having swelling, and at night my legs were restless. Also, I just wasn't healing as well if I got a mosquito bite or an ant bite. And I also knew that if I did have vein disease, it could lead to worse things.
Yeah. All right. Okay. So, Dr. Reincke, she mentioned some of the symptoms that you can have with vein disease. What are some of the other symptoms that people might go, this might be the problem? And, although it's common, it's not normal.
Okay. So tired, heavy, aching, restless legs as well, and then advanced disease, they can get even ulcers, wounds that don't heal, open ulcers.
Yeah, and she mentioned that she was not willing or healing as quickly as she used to. A lot of times people think this is a muscular issue, so they try to address it that way. Or, my sister-in-law once, she said, well, I think it's a dermatology issue, isn't it? It's not, it's what lies beneath. Tell us what's happening with those veins that's causing all these symptoms, these problems.
Well, underneath the skin, the veins are stretched out. The valves inside the veins, which normally open and close as the blood goes through and heads back towards the heart, those are stretched out. So blood is backing up towards their feet instead of going towards the heart. And it's that backup of blood that causes inflammation, and then that inflammation leads to symptoms.
All right. And when they come to your office, the first thing you do is make sure they get an evaluation to make sure.
Yes, a thorough evaluation,
yeah.
Correct. Not only look at their history, their historical information, but then we also, if it's indicated, we'll do an ultrasound.
All right, and that, by the way, it's non-invasive and very quick.
Yes.
All right, Valerie, so you got a procedure. What was done, and tell us what that was like.
I had the laser procedure, and when I got evaluated, they told me how many treatments it would take and how long. I was nervous, but I went in and it was amazingly quick, amazingly, it wasn't, painful, and I got great results. I went back to work the next day, no problem.
Oh, no, Valerie, you weren't supposed to go back to work. You're supposed to say, I'm having a procedure. I need to take the rest of the day off. You can go to the mall. Go to the mall. Don't go back to work. Anyway, the secret's out now. The secret's out now. All right, Dr. Reincke, and that is such an amazing advancement in technology that you can just go back to business. So what you're doing, like you mentioned, you're shutting down that vein, but there are plenty more other veins to take over, so people don't have to worry about that, right? Let's talk about the cost, because a lot of times people will stop and not do something because they're concerned about the cost, although your quality of life, I would imagine, is priceless.
Yeah. That's what we tell patients. So the one thing that we do is we make sure that patients know their financial responsibility based on their insurance plan before they would even get into treatment. We certainly don't want any kind of a burden for them. If it is too costly for them, something that I offer is payment plans, which are individualized for each patient, because we definitely want to get people treated.
Yeah, because it just gets worse if you don't.
Them treated.
Yeah, and a lot of insurance plans, again, do cover this, so don't make that stop you from going in. All right, one of the things that makes you different that your patients say is that, first of all, they understand that this is not only your livelihood, it is your passion, as we talked about earlier, but you make sure that you have a direct contact with all the patients, you answer all of their questions.
Yes. I would say something that's very different for me is that I give my patients my personal cell phone number. So after hours, even on the weekend, they can always contact me, whether they text me, call me personally, or even email me. I'm always available to my patients.
Yeah. And Valerie, how do you feel today?
Wonderful. Dr. Reincke is a superstar for me. My legs don't swell. I don't have the heaviness. I don't have the restless legs. And, I'm looking forward to working. Keep going.
All right. Well, ladies, thank you very much.
Thank you. Have a good day.
All right, you too. Reincke Vein Center has a special offer for our viewers. Mention Great Day Houston to receive a free office visit and evaluation. Call them at 281-394-4446. Again, that's 281-394-4446, or visit their website at reinkeveincenter.com.